unspoken. Let's say this. I work 6.5 days a week. Every day I turn the key, open the door, just come in. I love the smell of the barbershop, hum of the clippers. I was always fascinated with barbers as a kid. When I used to go into the barbershop and get my hair cut, I watched the barbers cut hair and I idolized them the same way that a young person would watch their favorite basketball player. So the barbershop, especially for the African-American community, it's always been a sanctuary. It's been a hub. It's been an information hub. We talk about everything from politics, sports, health. It's just one of those places we come together for camaraderie.
Me knowing Marvin, it really kind of all the way goes back to after graduating from IU, I moved to Indianapolis to start work at IU Health. And one of the first things I needed to do was just figure out where am I going to get my hair cut. I happened to find out that there was a barbershop maybe 2 blocks away from the apartment that I was at the time, and that turned out to be Marvin's Barbershop. And so I became a patron of All in the Wrist. Indiana University Health is focused in on making Indiana one of the healthiest states in the nation. We have collaborated with Indiana University through their School of Medicine, School of Public Health, and School of Informatics. With additional community partners, we formed the iHeart Collaborative. And the main focus of iHeart is really thinking through what are some of the creative ways that we can address health disparities in medically underserved communities by taking the resources that you would typically find in, say, a primary care office or a hospital. How can you creatively embed them in communities where they're a lot more accessible, but still give that good high quality of care, education, and referral to resources? Barbershops hold a very unique position as one of the few remaining third places, particularly for African American men. And so the barbershop is one of those creative locations.
So I was connected with this program actually through Calvin Sanders, and he was talking to me about the Barbershop 2.0 initiative. My mother and father both suffer from hypertension and high blood pressure, so it was a personal cause for me. I had no idea what the numbers were. Blood pressure is 181/90. I have no idea what that is. I didn't know that information until I met Christina and Calvin and we initiated the program.
IU Health really values a healthy community. They are trying to make Indiana healthy, and that's what we're striving for, and that's what community health workers come into play. As a community health worker, if I can just be a stepping stone for completion of what you need, it makes a difference, and I love it. So those who are fortunate enough to come to the doctor every 3, 6, yearly, it's great. But for the barbershop, when it came about, like, hey, we want to do blood pressure screenings and point of care for diabetes and high cholesterol in the barbershop in the community, like, yes. Having this program embedded in the barbershop helps address any social determinants of health for a patient, for the community, for anyone. So coming here, it's a big impact.
My name is Derrick Mack. Been knowing Marvin for 35 years, probably. He has a very good gift to gab.
You get that Pet Smart. It's like a green apple vinegar.
Marv always got his doors open. He's a helper, you know, so you can always come and find help here. I think it's a place where you can always come and get good news about whatever. I came here and got the news about my blood pressure. You know, I kind of knew a little bit about blood pressure, but when I came in and I had my blood pressure first taken, my first reading, I believe, was 180/110. So I actually went to the doctor the very next day, got on medication, and ever since been working to get my blood pressure under control. I think when IU came in and with the programs that they have, it gives you opportunity to go get any kind of help you need. And that's all you can give a person is that.
The majority of my clients who come in here are always willing to help and be supportive in any kind of way. So, and I'll just go outside, hey, come get your blood pressure checked. Know your numbers. Most people are coming in here and they want to know their numbers. They want to get their blood pressure checked. I've always been big on giving back to the community. This was just another way for me to use my talents and my barbershop to be able to help some people. This is just home. This is what I know.